Hi there, welcome to Athletico River Grove. My name is Stephanie. I've been an occupational therapist and a hand therapist here for 6 years.
My name is Andrew. I've been an occupational therapist for 6 years and a hand therapist for 3 years. We're so excited to talk about some of Athletico's hand therapy services today and walk through some of the many ways that we help our patients get back to the activities they love. Let's get started.
Here at Athletico, about 97% of our hand therapists are also occupational therapists, and about 50% of those are certified hand therapists. Occupational therapists work with people to improve or get back to daily functions, or as we call them, occupations. They primarily work with patients who have an injury or condition affecting the upper extremities, which includes the hand, the wrist, elbow, and shoulder. But OTs are qualified to help patients from head to toe. This could mean working with a patient who recently suffered a stroke, a brain injury, amputation, or a severe burn. While occupational therapists focus more on improving a patient's ability to perform tasks, physical therapists focus on more the improvement of specific body movements. This means that hand therapists can be occupational or physical therapists, but a hand therapist specializes in treating the hands and upper extremities.
Here at Athletico, we have a team of over 175 occupational therapists and 180 hand therapists, and have been proud to offer occupational and hand therapy services for over 20 years. Our hand therapists provide a number of services, but some of the most common injuries we treat are tendon lacerations and repairs, fractures and soft tissue sprains and strains, nerve injuries, amputations and replantations, elbow and shoulder injuries, and scar management. This can be done through the use of many treatment techniques, including but not limited to manual therapy, splinting, and wound care services. We also see a high number of workers' compensation patients within hand therapy, as a growing number of all workplace injuries include the hand and upper extremity. Let's take a closer look at each of these areas.
The first area we'll cover is our hands-on manual therapy treatment. Using our hands allows us to really get into muscle tissue and joints to work on mobilization and manipulation. This is really beneficial if there's any inflammation, swelling, or scarring, any muscle tension and joint tightness, and general sensitivity or pain that our patient is experiencing. We also have different tools at our disposal that our therapists are trained in using to assist with manual therapy treatment and support you in reaching your goals. Here, we're working with Jamie to address some wrist pain that she's been experiencing. I'm currently using manual therapy techniques to assess her current mobility, which is going to help me identify the root cause of pain. And from there, we'll work on some exercises and movements to specifically target those areas of weakness.
Accidents happen, and sometimes those accidents take place while on the job. When this happens, we support work comp patients throughout their entire recovery process so they can safely return to work. The best way to help someone prepare for their return to work is to simulate workplace environments and tasks that they'll be performing on the job so that there are no surprises once they make a full return to their role. If a patient is in construction, we'd want to focus on tasks like using tools, such as a shovel. If they work in a warehouse, we'll want to mimic the action of picking up and moving boxes. Or maybe they work in an office setting where much of their day uses fine motor skills to type on a keyboard. In all of these settings, we are taking note of specific job duties and customizing a plan to treat the injury while providing education to reduce the risk of future injury once our patients have returned to work.
Splints are used during patient care when an extremity like a finger or a wrist needs to be isolated to reduce movement during the healing process, or simply supported to improve function. The fit of a splint, or orthosis, is adjusted or customized based on the patient's specific needs. A well-fitting splint won't cause any friction, poking, or discomfort since they're typically worn for several hours at a time. There are two main types of splints, static and dynamic. We're currently looking at a static splint, which won't have any movement or flexibility to it. Dynamic splints are exactly how they sound. They're going to have more give to them so the patient can be able to maybe open, close their hand, or move the wrist a bit.
Hand therapists are highly equipped to help patients who require wound care, suture removals, and dressing changes. This includes, but is not limited to, burns, lacerations, skin grafts, incisions, and post-surgical suture removal. Wound care is a truly all-encompassing process. A hand therapist can help their patient to clean and dress wounds, as well as regain mobility that might have been impaired from scar tissue buildup or muscle atrophy. Location, severity, and patient history will all affect the healing process and should be considered by the hand therapist. Whether we're texting a friend, cooking a meal with our family, driving a car, or lifting our little ones, we rely on our hands and upper extremities every day for almost every activity that we do. Being mindful of our hand, wrist, elbow, and shoulder health is crucial to living life to its fullest and navigating the occupations that make us who we are.
Our team of hand therapists are here to help you every step of the way to feeling your best. Regardless if you're experiencing minor pain or have a serious injury or condition, or if you simply want to learn tools to improve function, we're here and passionate to help you reach your optimum health. To learn more about our occupational therapy and hand therapy services, or to locate an expert near you, please visit our website at www.athletico.com.